This is the Total Joint Preoperative Teaching class. My name is Ryan McIndoe. I am the Joint Center Coordinator here at St. Alphonsus Regional Medical Center. Today we'll be going over how to prepare for a total knee or a partial knee replacement, a total hip replacement, and if you are having a revision of any hip or knee surgery, this will be applicable to you as well. The material that you'll need today is the patient guide booklet. I'll be going through some of these slides, letting you know which page number to look at, and I do highly recommend taking notes as we go through this too. There is a notes page on the very back of that booklet, or if it is easier for you, go ahead and just take notes on a piece of paper, but I highly recommend write stuff down as I go through this today. Not every slide I go through does have a page number. Some stuff does change a little too fast to get out to print and keep up to date that way. So just make sure you have those notes ready for you. About us here at St. Alphonsus, we have been doing total joint replacement for decades now, and we do have a unique program that works for our community here. We have different teaching approaches, both trained orthopedic staff and then a team approach with that staff. What we mean by that is physical therapy and occupational therapy will both see you. They're going to make sure that you can walk safely, get in and out of bed or on and off a chair safely, or even at your bathroom duties such as getting off a toilet or getting in and out of a shower. How to do all that safely. Nursing will be implementing a lot of your cares and of course helping with your medications afterwards, after your surgery is done, and they'll also be prepping you and helping in the recovery process after your surgery. The surgeons, of course, will follow everything surgically going on with you, and that does mean that knee or hip. But there's also nurse practitioner hospitalists that will follow you medically. And so everything will be covered as far as, are you moving safe? Is everything going on and surgically stable? And are you medically stable? All those will be covered before you discharge by this team. We do implement clinical practice guidelines, and what those are, they help give proven treatment through research to make sure that you are getting the best care possible, both for before surgery, how you're preparing yourself, and then for after surgery, making sure that you have a safe recovery and that you have the best possible outcome that we can. And again, those are evidence-based, and they give us the ability to give you the best care possible. We do use a customized therapy approach based off your needs and your physician's preferences. What I mean by this is that we will look at you as the individual and not as a whole group. So we will approach you based off what specific needs you have. And while we have more of a generalized approach for how we want to see each patient, we will then customize it based off what you have to deal with. And then also based off what your physician is wanting for you as well. Discharge, we are doing many discharges on the same day of surgery now. And with that, again, we use a lot of research to make sure that you are having the best possible outcome with that and that you have a satisfied stay as well. We do have patients who do have to stay 1 or 2 days still, and this is just based off of, again, the individual, and your surgeon is the one who's going to make the decision as far as what is the best plan for discharge, and we will then go from there based off how you progress. If you do have to stay the night, do not be surprised if we can discharge you before noon on that day. We do a lot of the therapy in that morning if you stay the night, and everyone will round that needs to round on you that morning as well. Our goal is to make sure that you have a safe, comfortable, and quick recovery. It is important to have a coach or family member there to help you once you get home. Coach is just a term that we use for whoever will be assisting you at home after surgery. It is important to go ahead and open up your booklet now to the page right before your table of contents. And this gives the outline of what we expect from that person, the coach, who will be helping you at home after your surgery. To give a quick overview of this, a coach is an adult or group of adults who can help you with those first nights at home, and we do say at least the first 3 nights at home that you will definitely need help. The help you'll need with is with mobility, meals, and medication. When I say mobility, you can do a lot of things independently, such as sitting or standing from a chair, getting in and out of the bed. However, they're there to help make sure that you are safe with that. And so they are not expected to be able to try to lift you with those movements, but more of just make sure that there's nothing you're going to trip over, that if for some reason you stand up and you get a little dizzy, that they're just there to help stabilize you and to keep you safe with walking. Of course, helping with meals and prepping those or getting them ready for you. And then new medications, they can help keep track of the new meds you'll go home with, whether it be new pain meds or your anticoagulant, for instance. They're there to help make sure that you're taking what you need to be taking and that you're following the guidelines that we have for you once you're home for taking those meds. This person should probably drive you to your first follow-up appointment. Now, it's important to have this person to do this part so that they can help give feedback too about your recovery process from surgery up until that first follow-up appointment. And they can learn alongside with you at that appointment to just know what the next steps are for your recovery. The coach will also remind you of ways to stay safe. They're there to help make sure that you do things the right way, whether it be walking, standing up straight, staying close to your walker, just things like that, as far as keeping good mechanics and doing things a safe way, they're there to help make sure that you keep those until they become more of a habit for you. At this time, we are allowing one visitor each day during your stay. So this does not mean that you can have one visitor and then they go downstairs and switch out and have another visitor come up. It is one single visitor, one single person that is allowed up each day. So we do highly recommend that the person who comes up and sees you in the pre-op area for your preparation for surgery or for the recovery process, that it is your coach who can then learn alongside with you. And whoever your coach is, just tell them thank you for us. It's a big commitment. We understand that part, and we also understand that is a very important part for your recovery process once you get home. Therapy sessions will begin on the day of surgery. In fact, therapy will probably come and see you within a few hours of arriving into the room that you will recover from. The goal for every patient is a minimum of 10 feet. This is all age groups and all physical abilities, 10 feet. If you are more active, then know that we will encourage more than just 10 feet. But this is a common goal for every single patient. And again, we will customize this based off of your physical abilities. This may vary between hospitals as well, but know that in Boise, this is our goal. You will also, if you are discharging the same day of your surgery, get passed off by each therapy, physical therapy and occupational therapy, on the same day of surgery. And if this does not happen and you need to stay for more therapy, then guess what? They will see you the next day. So you will continue to see each therapy each day that you are here in the hospital, as long as you need to stay here until you are safe to discharge home. Precautions and recommendations for the surgery. For hip replacement and knee replacement, you will notice both of them say avoid limping. Do this as soon as you can to the best of your ability. We understand that it can be hard not to limp because of pain, but also understand that some people limp out of muscle memory or out of habit. And so if you're doing it out of habit, please try to pay attention how you're walking, smooth that gait out as best as you can, and the sooner that you do this, the easier your recovery will be. For hip replacements, you may have precautions involved with this. These precautions would be limiting certain movements such as twisting or bending over or internal rotation of that leg. Your therapist and nurse will have orders placed from your surgeon specific to the precautions that you may have, and they will teach you on these after your surgery. It is good to understand that these precautions will not last you the rest of your life. These precautions will last during the healing process, which usually is 6 to 8 weeks. During this time, when you follow these precautions, it will help make sure that your hip does heal appropriately and that we have the best outcome possible. It is a very similar mindset to when you buy a brand new car and they tell you the braking procedure for that car's engine. You follow that procedure, and when done appropriately for that period of time, then you have an engine that will last you a long time. The same idea is going to be with this hip. Follow the precautions with what we want you to do and what not to do. And when you follow those for the 6 to 8 weeks and let everything heal appropriately, you will have a hip that will last you. Now, as far as knee replacements go, we want to both bend and straighten that knee. When we talk about bending it, you can bend it too far initially. So a good goal within those first 2 weeks or so is to get to a 90-degree or just slightly past that to a 100-degree angle. You don't really need to go past that the first 2 weeks because we want that incision to heal. While you are relaxing though, work on straightening that knee. This is usually the harder part. The best way to do this is while you're relaxing in the recliner, get your leg up, or on a couch, same thing, get your leg up, and then you can put something underneath the surgical side under the ankle, and then let the knee straighten by gravity, letting it come down. When the ankle is up like that, the knee will straighten easier, and do this exercise while your pain is controlled. You do not have to do this all the time. You do not have to sleep with it straight at night. But while you're awake and your pain is controlled, work on straightening it. The idea is that you'll be able to be weight bearing as tolerated after the surgery. If it is any different, your surgeon will let us know. When we say weight bearing is tolerated, that means that you can put all the weight through that surgical side as much as your pain will tolerate. It is safe to do so. You will not hurt that joint. As far as the pain goes though, get a feeling for that the first time that you stand up. Don't take steps forward immediately, but stand in place and take steps in place. See how much you can handle through that joint, and then you'll find out if you need to use the walker to take some of the weight off of that leg with the steps moving forward. Get an idea standing in place first. You are able to sleep in any comfortable position that you want. You can sleep on your side if you want to. You can sleep on your back. Some patients like to sleep on their stomach. Whatever is comfortable, go for it. Pillows will be handy though. Have those between your legs. That will make it more comfortable. And if you're on your side, you might want a pillow in front of you or behind you to lay into to get comfortable. You will feel like Princess and the Pea for a bit, but having these pillows there to help keep you comfortable will help things out until you figure out the comfortable positions after surgery. Starting with therapies, we'll go over occupational therapy. If you do not see occupational therapy, then you will still go over these same things, but with a physical therapist. Occupational therapy goals are they're going to go over with you the activities of daily living and educate you on how to do those safely. This may include the need of assistive devices. The activities they'll go over are lower body dressing, showering, whether that be in a tub or a shower stall, and then toileting. Now on page 6, we're going to go over some of this equipment that you may need. At the very least, what we need you to have prepared for home will be a front-wheeled walker like I have circled here. This is where you have the wheels in the front and the posts in the back. The second thing that you absolutely need is either this shower chair if you have a walk-in shower. You can also use these for tub showers many times. However, if you don't mind spending more money, tub transfer benches do work better for a tub shower. This is where the wider the chair is, it can then go over the end of the actual tub itself. You sit on it, then you scoot back and swing your legs over the tub. This can make that part a little bit easier, but yes, it can still be done with a shower chair if needed. As far as other items that we're going to go over here real quick, first is going to be the dressing stick or reacher. You'll notice the one that we have here. This is the best type to get. This can act also as a dressing stick when it's got the notch at the end like I just drew on, and that does help with getting dressed as well. This is the style reacher that's going to be the strongest. The ones that have 2 clamps that come together will not be as strong for these items as far as getting dressed and all that, so just know that this is the best type of reacher to get if you're going to go and buy one. Now sock aids, those are a couple different styles as well if you want to get one. That's how it looks right there. This is not to be confused with the sock aid that are used for compression socks. This is just for regular socks. There are hard style that are plastic, or there are soft style that are more of a cloth type. Your therapist can then recommend based off how you're doing with which one you may want to get. Those will help with getting socks on so you don't have to break a 90-degree plane. with your thighs to your body, to your torso, such as if that's the precaution that you have for a total hip. It helps with going down if you cannot reach your toes, just from pain as well. It makes that part a little bit easier. Now, elastic shoelaces, you can go ahead and get those if you want, especially for people who have diabetes and you may have to be in orthotic type shoes. If you need to use those types of shoes, elastic shoelaces will help. Main reason being is that you will have swelling that goes down to your feet and ankles. This helps make sure you're not having to retie every single time and make your life easier. Long-handled shoe horns can be handy as well. You notice we specifically said long-handled, not short-handled. Again, if you have these precautions with bending at your hip, long-handled shoe horns will make this process easier. Now with raised toilet seats, not every person will need raised toilet seats. If you have the chair height toilet seat already at home, many times that will suffice just fine. You don't have to worry about it. If you have the regular height toilets, this may be something that you want to get. The recommendation I have is if you're having a hard time getting off the toilet currently right now, then you may need that toilet riser afterwards. Also, you'll notice that the toilet risers come with handles. They are removable. So sometimes if a patient is just needing that extra height to stand up and nothing to push off of to stand, then you don't necessarily need the handles, and they can make it harder to wipe and that sort of stuff as far as being on the toilet. If you do need something to push off of, that is where you have the handles present and you can push off and then grab the walker and start walking. As far as shower chair goes, again, you will definitely need one for home so you do not have a fall in the shower itself. It is important to remember that 80% of falls happen in the bathroom, and it can be from fatigue. We can avoid this one altogether by having a shower chair that you can sit in and not have to worry about getting fatigued and slipping in the shower. Have this there, it is very important. Again, you can either get the shower chair or a tub shower. A little hint here as well, if you do get a shower chair, do not get one with handles such as what you see on the toilet riser. Those will get in the way and it'll make your life harder. Have one without handles on it. Also understand that you do not have to get these other items besides what I specifically mentioned you need. So toilet riser, reacher, those items you don't have to get. If you want to, you can, or if it's recommended by the therapist, then they can have our case managers in the hospital order them for you and have either delivered to your home or have ready for pickup on your way home. Also, it's important to know that you don't have to buy all these items brand new. You can get many of these items from a secondhand store. So you can get them from a Salvation Army, Vincent St. Paul's. If you want to get something like that from those places and you don't mind having a used item, many times you can find them there for cheap. A lot of these items are not covered by insurance. That is another reason why maybe getting it used can help. Front-wheeled walkers many times are, but everything else I mentioned besides that front-wheeled walker are not covered by insurance. Now, physical therapy, they're going to be the ones that more focus on functional, general mobility, and safety. So, can you get out of your bed safely? Transfer from your bed to your chair or vice versa? Are you walking with good gait and walking safely? And if you have stairs at home, are you doing your stairs safely? They will also help make sure that you understand your exercises that will be done after your surgery. Physical therapy goals that you need to meet before you go home. You'll find them listed on page 13. You need to be independent in and out of your bed. Do not be surprised that if in the hospital, your nursing does not automatically help with getting things done for you to get out of bed. We do want to see and evaluate how you do with doing this task, and we will help as needed, but know that automatically we are not going to be lifting the leg to move it. We want to see your strength and mobility. Independent, sit to stand with your walker. You'll notice some of these do say also with crutches. These are for people who come in with crutches. They will go home on crutches, so sometimes they're getting this surgery due to an injury. If you have no experience with crutches, you are definitely going to be using that walker. Now, as far as independent sit to stand, when you do this, again, do it safely. We can help you if needed, but we need to see you do this without our assistance. We also want to see you walk independently 150 feet with your walker. This does not mean you do it by yourself, but this means that we are there watching you, but we are not having to assist with you walking. You are doing it independently as we are there making sure you're still safe. Also keep in mind that 150 feet walk, that means that you are walking out 75 feet and then walking back 75 feet. This needs to be how you do things at home as well. Gauge how you're doing. Always go until you're at half a tank with your energy, and then turn around and come back. Do not go until you're exhausted, because it will not be safe to then try to walk back to where you can sit down. You need to be safe to go up and down steps. We will help make sure that you are safe in this training. We have different types of steps to practice on, but you need to then show us that you can do this while we watch you. There's, again, different steps to do, or if you just have a threshold with one step to walk into your house, we have that as an example as well. But just know you'll practice on what is closest for your home and will not discharge you until you are safe with us. We want to see you be independent with your home exercise program. Again, they will go over these exercises of what are specific after your surgery, and they will individualize this for you. But you need to demonstrate that you can do these when you go home. The last thing, you need to demonstrate your consistent safety awareness. I need you to show us how to do all of these items safely. Do not get overconfident in that you try to do things by trying to do it a faster way. Show us how to do it safely, and in doing so, you will find that you have better outcome overall. Don't try to cut any corners. Do things a safe way and have a good, safe recovery. Page 8 goes over more specifics with your physical therapy on day of surgery. If you are medically stable to do so, you will get up with physical therapy and then get up and walk with them. Early walking does help with pain. There was a little study we did at St. Alphonsus roughly 4 to 5 years ago, and it did show that the people who walked the day of surgery had better pain scores the following day versus the people who did not walk the day of surgery. This will help with your stiffness and make sure that you are more loose the next day, that the muscles move easier, and it in turn helps with pain. As far as mobility goes, it also does prevent your risk for blood clots. By getting up and walking with therapy, we're getting that blood moving, and that will help reduce that risk of blood clots. Now, walking on day of surgery is also very beneficial, but the amount that you need to walk, again, at least 10 feet, more is encouraged, but do not overdo it that day of surgery. For the physical therapy, the day after surgery, or for those of you who plan on leaving the same day, you will do this same set of therapy. You'll get up in the recliner. The thing with this is you guys are not sick patients, you guys are well patients. So it is always important to remember that act like you are at home. Get up in the recliner, get out of that bed, because you will not be doing that at home. So get up in that recliner and it will help with your process for therapy and getting ready and feeling ready for home. Now, as far as walking, you can have up to 2 walks daily with therapy. You can walk more, of course, with nursing, but with therapy, it'll be up to 2 times a day. You'll practice getting in and out of bed with the therapy. Practice stairs. Now, car transfer education, I'll go over that in just a minute. And then exercise instructions specific to you. On page 23, flip to there, and that's where we have the car transfer education. There is also a video that we will hope to be posting on our website, and that will go over the car transfer education specifically. We want you to practice this before surgery, so I want you to practice in a car. Act like you have a leg that had surgery on it and figure out which car is going to be easiest to get in and out of. You'll notice here, this person who is playing the patient, the seat comes on the upper part of the thighs. That is a nice level for that seat to be at, where patients say it is usually the easiest height to get in and out of. You can do cars a little bit higher, you can do cars that are lower, but this is going to be the height that will be easiest for you. And again, practice getting in and out before surgery happens, and act like you have a surgical leg. Now bring pillows or blankets if you want to help with that seat height. If you have a very, very low car, this can help with that part of sitting down. But as far as how to position the seat, you do want to get into the front passenger seat. This is usually the easiest. Main reason being that we want you to put the seat all the way back, and then we want you to be able to recline that seat back as well. In doing so, it'll help with mobility. If you have a hip that you cannot bend past 90 degrees, you can meet the 90 degrees, and as you scoot back in that seat, you can rotate but lean back at the same time while bringing your leg up. And in doing so, you do not break that precaution of 90 degrees, and it makes it easier to swing that leg into the car. You then sit up, bring the leg down, and sit as normal. Same procedure would be for getting out. You can recline it back, have the seat all the way back. And as you recline back, that means that you can bring your knee up farther towards you without breaking 90 degrees at your hip. That can make it easier to swing that leg out. And this can also be the case if you have a knee that is not quite wanting to cooperate yet and bend as far as you'd like to get in and out of a car. It'll help in those circumstances as well. Next, we'll go over the exercises you should be doing before your surgery. Start these as soon as possible to help gain strength and mobility sooner after surgery. You'll notice with each of these exercises that you'll do them 10 to 20 times, and then you'll do all of these exercises 3 times a day, which means you'll do all 6 of them in the morning, 6 of them midday, and 6 of them in the evening. I'll briefly go over those exercises with you. First, you'll do ankle pumps, just like you're pushing down on a gas pedal and pulling your foot back up towards you, 10 to 20 times, and do both feet. Glute quad set will be done 10 to 20 repetitions. This is where you act like you are pushing your knee into the recliner where this gentleman is sitting, and you want the top of your thigh to then contract. Number 3 is short arc quad. You'll see he has something rolled underneath his knee, and then he straightens his foot out with his toes pointing up in the air. Do those 10 to 20 times, holding that foot up in the air for 5 seconds. Heel slides. What is trying to be shown in this photo is the leg is out straight and then sliding the heel up towards you, bringing the knee up close to a 90-degree angle. On the 5th one, you'll notice he is laying down for this in his bed. This is where you lay down flat, keep your feet next to each other, and one leg at a time, you swing it out to the side, hold it there for just a minute, and then swing it back. Do that 10 to 20 times. 6 is a straight leg raise. You'll notice that the toe is pointed up, and get that leg straight and pull it up, lift it up just about 12 inches or so. Hold it there for about 5 seconds and then bring it back down. Last is chair dips. You'll notice that this gentleman is sitting in a recliner. You can do it there, or if you have a kitchen chair with arms on it that does not have wheels, you can also do it in that type of chair. You'll keep your feet planted on the floor, and then with your arms, push up into a locked arm position where they're straight. Hold it there for about 5 seconds and slowly bring yourself back into the seated position. Do that 10 to 20 times. Next, you're going to hear more from nutrition. They'll give you some information on what you can be doing before surgery and after surgery. And it'll just help you make sure that you heal well as if you're looking at losing weight after the surgery, about what you can do about that safely.
Hi there, my name is Emily Clay. I'm a registered and licensed dietitian here at St. Alphonsus. I was asked to be part of this presentation to discuss how nutrition can support you in the healing process in multiple different ways. So we're going to talk about nutrition and healing. We're going to talk about blood sugar control and decreasing our A1Cs if that is something we need to address. Maybe weight loss if that's something that may be beneficial for you in your new joint replacement. So to start off, we're just going to talk about nutrition and healing. So there is a lot of research that proves that if we have good protein stores going into any surgery, you heal better. So as you kind of prepare for your surgery, try to increase more protein into your diet. We know that surgical outcomes are better when we do this. We also know that after surgery, protein plays a huge role in healing. It helps heal our skin, our joints, helps maintain our muscle mass. It helps build muscle mass. So protein, you'll hear a lot from me today. Some good protein sources are listed there. Obviously, our meat sources like fish, chicken, turkey, beef, pork, tuna. Those are all great protein sources. Greek yogurt, 2% cottage cheese, protein supplements or drinks, eggs, string cheese, low sodium lunch meats are also good protein sources. And then if you are more vegetarian, beans, tofu, edamame, lentils, those are also pretty good protein sources that we can start consuming before your surgery and then continue afterwards. And that way we know we're getting a lot of protein, which will help your healing process. Some more information on protein. Because it is so important, we know that protein can help stabilize blood sugars. Protein by itself typically does not raise our blood sugars. So by incorporating more protein into our diet, our A1Cs can improve, our blood sugars are more stable, our energy is better, and we know when we're doing all of those things, if weight loss is a goal of yours, having more stable blood sugars will help in that goal. Protein also helps build and maintain our muscle mass. So eating adequate protein does not make you muscular. Exercise is what creates muscle mass, right? But if you want to repair that muscle mass and get stronger, you need to be eating adequate protein. Not only protein, you need to be eating adequate calories to do so. So by eating, 3 meals a day, every time you have a protein source, that makes that a little achievable. So a good practice is that you try to have a protein source at every meal and every snack that you consume. So an example of a snack would be like a small piece of fruit with a cheese stick. So you have a carbohydrate, which is the fruit, and then you have a cheese stick, which is a protein source. Maybe you will have some baby carrots dipped in peanut butter, for example. You have a vegetable with a protein source. Sliced cheese with 6 whole wheat crackers. So if you can kind of get in the habit of adding a protein source to every meal and snack, this will help your overall health and well-being, and certainly support your energy and mood and those kind of things. If you are interested in weight loss before surgery or after, we really need to be feeding our bodies adequately. So by eating 1 meal a day is not supporting your body, right? There's no way you can get all the nutrients that your body requires on eating 1 meal a day. So we should all be trying to eat at least 3 times a day. So breakfast, lunch, and dinner, whatever it looks like for you. And then at every meal, you have a protein source, like eggs, meat, or dairy. You have a fruit or vegetable, which is great fiber. It's great for our heart health, our brain health, our gut health, all of the things. Whole grains. Now, whole grains typically have a little more fiber and nutrients in them. So switching to brown rice or whole wheat pasta or whole wheat bread or whole grain bread, it's a great energy source. Carbohydrates do give us energy, and they shouldn't be avoided, but they should be part of the meal and not the entire meal. We should be consuming healthy fat sources like olive oil, avocados, avocado oil, nuts, seeds. We should try to limit butter and fried fats and trans fats. Fried foods, I mean. So by adding healthy fat and a whole grain and a fruit and vegetable, we feel more satisfied. Your body has gotten a complete meal, which can help with, boredom eating or snacking or cravings, all of those things. So if you eat 3 good meals with all of those things included, oftentimes you feel more in control of the snacking and some of the things that some of us deal with. It helps with blood sugar control when we have all the things at each meal. So really strive for that. And I have a picture of this on the next slide. But the other thing I wanted to mention about weight loss is monitoring how much sugar you're consuming. We know that A spikes blood sugar, B is not nutritious. It's not offering your body any nutrition really. And pay attention especially to our liquids. If we can cut back on high sugar beverages like soda, specialty coffees, Gatorade, sweet teas, lemonade, those kind of things. It's an easy way to get less calories consumed, which can help support weight loss goals. It helps with our blood sugar control, and which helps support our weight loss goals and our A1Cs and healing and all of that. So pay attention to that. We should all be striving for about 64 ounces of water, unless you have some sort of cardiac issues where your cardiologist told you that you should be not drinking that much, but adequate for most people with about 64 ounces of water. So strive for that every day. We know that if we're adequately hydrated, sometimes that can prevent cravings and that kind of stuff. So water is good for that. We should be focusing on non-caffeinated, non-carbonated beverages for most of our beverage intake. So this is a good guideline if we're trying to eat a good protein source, fruits and vegetables, whole grains. This is kind of a visual picture on what that might look like. So on the top right hand side of the plate, you can see whole grains. So using like whole wheat bread, whole grain pasta, brown rice, and the portion size is about a quarter of the plate. Right below that is your healthy protein. So fish, chicken, beans, pork, fish, I think I said that. These are great protein sources. So, you know, a little more than a quarter should be your protein. So you have that on there. And then you can see that the vegetable piece of that plate is a little bit bigger, right? Because vegetables tend to be high in fiber, low in calories. They are typically not raising your blood sugar, right? And then obviously having a little fruit with every meal and snack. This is how we get our fiber up, which is great for our heart health and our brain health and our digestive health. So have your plates, fruits and vegetables. And if you can model this for most of your meals, you're eating a very balanced plate. And then obviously in the top left there, it says healthy oils. We should probably be eating, cooking with olive oil or avocado oil or even canola oil, you know, limiting extra butter and those kind of things, because those are saturated fats. But it doesn't mean you can't have them all the time, but it's trying to just change the way we're looking at our plate and how we're doing that. Okay, so in conclusion, nutrition does help with the healing process, blood sugar control, any weight loss or weight gain goals you may have. If you feel like that you would benefit from having something a little more individualized, if you have food allergies or lots of food preferences, we can certainly work with you one-on-one. Our number is listed there. It's 208-367-7190. Even if you have a quick question, please don't hesitate to call. And I think that's it. So I wish you well and hope you have a great day, and look forward to hearing from you if you need to. So thank you.
I am done with the therapy portion. Now we're going to talk about preparing for this. You know that we'll talk a lot about how to minimize complications. This is not to cause any anxiety. This is to let you know and educate you on what you can be doing that will help you based on a lot of evidence-based practice. So what is research telling us will help you, and I want you to know those so that you have a good outcome. Now for those of you who do have pre-surgical screening, this is mostly for Boise and Nampa. Here is what you can expect for this. If you are Ontario or Baker City, they may do this in the office. As far as pre-surgical screening, it will be scheduled for you. You do not have to worry about calling them to then make an appointment. It'll be done by the office for you, and you will be given the date and time. Expect that this appointment will be 1 to 2 weeks before your surgery. The purpose is to obtain baseline information about you. We want to do things like lab work and see how that's looking. Maybe we're going to do a EKG to check your heart health. They're going to want to get your health and surgical history. We'll do a lot of testing just to make sure that you are safe for the surgery before it happens. In Boise, there will be a nurse practitioner hospitalist that will see you at this appointment, and they will evaluate you after your surgery as well. Bring a list of the medications you take to this appointment. Do not bring the medications themselves unless you are coming to the hospital for your admission, and you can bring multi-use items such as eye drops, inhalers, and nasal sprays. Those multi-use items are okay. You'll need to get clearance once you get in the hospital. Let them know you brought them, and we'll get it okayed. Anything that is pill form, we will provide. The nurse will tell you what medications they want you to take the morning of your surgery. They'll tell you this at this appointment. Do not be surprised if they tell you to stop taking aspirin or other types of NSAIDs, such as ibuprofen or naproxen. Tylenol is not going to be on that list. It is safe to take because Tylenol does not affect your bleeding. These other NSAIDs do. This will include all over-the-counter urban supplements and multivitamins. An example of an urban supplement that does affect your bleeding is turmeric. A lot of people I see take this for pain relief with their joint, but this will affect your bleeding, and so they'll have you go off of this prior to your surgery. They'll have you stop these at least 7 days prior to your surgery unless you take aspirin for heart-related issues. If that is the case, they'll tell you when to take it until a safe period of time and then stop. And this can be for any type of anticoagulant. If you take that currently before your surgery, they will also tell you at this appointment when the safe period of time will be to stop it and then restart. You'll be given a chlorhexidine gluconate, or called Hibiclens, scrub to be using at home. I listed it as CHG here to make it a little bit easier. Now this scrub, you'll go home and use it a total of 3 times. There will be directions on how to specifically use it, and I'll just do a brief overview on this. When we say the 3 times after you use it, it actually starts 2 days before your surgery, and the third time will be the morning of your surgery. So the example would be, if you have surgery on Wednesday, you'll start on Monday. Second time will be Tuesday, and the third and final time will be Wednesday, the morning of that surgery. When you use a scrub, start using clean clothes every time. Don't reuse any clothes, and then also anything that you need to use to wash yourself or dry yourself with, clean as well. So this means washcloths, do not hang dry those and use the next time, and the same goes with towels that you use to dry yourself off with. Do not hang dry and use again. Use a clean one every time. You do want to change your sheets on that first day you start using the scrub. You do not have to change them on the second time or wash them by that time, just that first night you use the scrub. Also, when you go home, just do what you normally do for sheets, but if anything does get dirty on the sheets, change them, but you will not follow the same routine after your surgery. Do not use lotion after performing this scrub. If you missed a tiny spot with the scrub, then what will happen is if you use lotion, you rub lotion around, and that little spot where there's some bacteria sitting will be rubbed all over your leg or anywhere on your body, and we're back to square one. So do not use lotion once you start using the scrub, so that the second or third time you will get full coverage by using this scrub. The likelihood of missing a small spot every 3 times is very unlikely. The likelihood is that the second or third time you will get full coverage when you add all of them together. Do not shave your legs for 7 days prior to surgery, but really this goes for anything that causes any sort of cut, nick, or open sore. For instance, it is summer, so I have patients who are gardening or, for instance, mowing or using a weed whacker. Be careful when doing these activities. Anything that can have a rock flip up and hit you in the shin, cause a sore like that, if it's within 7 days, do not be surprised that your surgery will have to be delayed until that is healed. If anything like this does happen, we want you to call the office right away. Do not wait till morning of surgery to inform the surgeon about this. Let them know as soon as you can. On page 5, it's going to go over how to clean and prepare your home. I'll go over the basics here real quick. Make sure that you have all your laundry ready, including clean towels, washcloths, and sheets. Once you start using that soap we just talked about, the scrub, please do not let pets sleep in bed with you. This will also go for at least 2 weeks after your surgery. Pets can cause a risk for infection, and we want to have them completely off the bed just so that nothing happens. So not even on top of the covers, we need them off the bed. If your pet does like to jump up on the bed in the middle of the night, then we do need to get them out of the room. Have a plan in place for this. I do understand that this can be a big headache for a lot of patients out there, but know that this is to make sure we limit the risk for infection and that you have a good outcome for the surgery. Pick up any throw rugs, electrical cords, any tripping hazard, get it out of the way. This will ensure that you have clear pathways with your walker and that you don't trip over anything causing any injury. I also recommend practice with your walker ahead of time. So if you can get your walker before your surgery, practice going through your house. Make sure that you can get through your hallways, through your bedroom, without having any furniture in the way, and that you can also figure out how to get in and maneuver around your bathroom with your walker. Again, falls, the most likelihood of where they will happen is going to be in the bathroom. So practice with that walker. Figure out, do I need to walk through the doorway sideways because you live in an older house with a skinny doorway for the bathroom? If that's the case, figure out how to do that safely. And I, again, always recommend when you go to the bathroom, keep the walker with you. What I do not want to have happen is to where you have a fall walking to the bathroom because you're in a hurry. Have your prioritization like this. I'd rather have you have an accident where you have to change your underwear and your pants rather than have an accident where you fall and injure the knee or hip or injure your head. So just know that you can always clean it up if an accident happens, right? If you don't make it to the bathroom in time. But having an accident happen where you have a fall, we do not want that. We can avoid that. Practice going through your house, how to maneuver around everywhere, and this will help make sure that you have everything made easier when you go home after the surgery. Bowel care, you do want to write this one down. You do want to prep yourself with something like a stool softener like Colace or Docusit, or a fiber supplement such as Metamucil or Miralax, and start at least 3 days before your surgery. The big reason being is that anesthesia alone can cause constipation. Pain meds can also cause constipation alone. Not walking as much can cause constipation alone, but now we have all three of those things combined, which can really cause constipation for some patients. Prep yourself with one of these items. If you already take it, keep taking it. Don't make any changes. But if you do not already take one of those medications, start at least 3 days before your surgery, and this will make things easier for you afterwards. For what to bring to the hospital, page 4 goes through all of these items that would be necessary to bring. Keep only 2 of these necessary items, and that will make our life and your life a lot easier, especially when you don't have family that can come help bring items in and bring items out. As far as the booklet that we're going over today, the patient guidebook, bring that with you when you come to the hospital. Also, if you have a living will or advance directive and it is not in our system here at St. Alphonsus, please bring that with you the morning of surgery or a copy of it. We will scan it through into your electronic record and it'll be there from that point on. It is important to have, especially for patients who, say, have confusion after anesthesia, that sort of thing. Many times power of attorneys are listed in these documents, and it lets us then go to talk to the people whom we need to talk to that you would like to advocate for you, and just help make the decisions that need to happen, whether it be figuring out the discharge process, that sort of stuff. It'll just help smooth anything out, and especially during this time where it's not as easy to have, again, visitors come in and speak for you, this helps out tremendously. Comfortable, loose-fitting clothing, shorts or pants, 1 or 2 changes. Now shorts, those can be more comfortable for a total knee patient, mainly because pants can tighten around a knee when you bend it. So whether you're standing to sitting, moving around in bed, whatever it might be, shorts can be more comfortable. As far as pants go, you can still wear those. In fact, sometimes again they're more comfortable for you. Or hips, you can wear shorts or pants, it does not matter. But you do want to have something with a elastic waistband. So an elastic waistband will be more comfortable because swelling will set in, and anything too tight will get uncomfortable or at least make it more difficult to get on. So something loose fitting with an elastic waistband. For women, if you want to wear a nightgown, that's completely fine. I highly recommend, though, bring whatever you plan on wearing at home so that you can practice getting changed into those items rather than having to figure it out when you go home. Rubber-soled shoes with a back, easy to on and off, closed heel, closed toe. So like I mentioned earlier, orthotic shoes are fine with elastic shoelaces. You can wear slippers, that's fine as long as they have a rubber sole with a back to that heel. I do not want to see anything like a Birkenstock or Crocs or flip-flops, anything like that that can slip off real easily, because then what happens is it's a tripping hazard. So be safe with that. Wear something that will stay on when you walk and have that rubber sole to it. Personal hygiene items. We have the basics. We can provide shampoo, body wash combo, a toothbrush, toothpaste, anything that you can think of, we've got that. But if you want to bring your own items, you can. Walker. Have that thing labeled, at least with some sort of identifier on it. That way, during the day of your surgery and after, it's easy to make sure we have it with the right person as you move from one place to the other. CPAP or BiPAP. If you wear one of these items, please bring the mask and the hose that attaches the mask to the machine. Bring those two items. If you want to, we are allowing you to bring the whole machine as well, as long as you do not put too much oxygen on it at night. What I mean by this is if you have to do supplemental oxygen, that may become a barrier with using your own machine in the hospital. If you do not have that barrier, then you can use your own, and it can sometimes make life a little bit easier. When it's time to sleep, you let the nurse know how to set your machine up when you turn it on, and that's it. Rather than having to use our own machine, where we have to go, have respiratory therapy, gather the equipment, bring it up, and then get the settings that you use at home onto this new machine. It can simplify things by using your own machine. There is a waiver involved that you will have to sign that does state that we did not test your home equipment, but once you do so, you can use it. As far as valuables go, please leave them at home. So that means any jewelry, including your wedding ring, any bracelets or watches, any earrings or necklaces. Anything like that you have to take off for your surgery. And we recommend don't take it off in the hospital, take it off at home and leave it at home. Again, there's not family that can come in with you the day of surgery. So this will just make sure that you know where these items are at all times and make that part easier. Glasses, hearing aids, dentures. We ask that you please bring those with you. Those are going to help make sure that you are learning appropriately, that you can read anything we give you, that you can hear us when we're educating you, and of course make anything easier with eating. So please bring those items, but bring the cases that they go into. As far as that goes, don't leave them on a food tray. I cannot tell you how many times I've had items accidentally get lost by being set on a food tray and getting covered up by napkins or the lid for the plate. Also, do not leave any of those items sitting on your bed. It can get tangled up into a blanket. I've worked on this on the 9th floor in Boise for about 9 years, and one time as a nurse on the floor I actually needed to get glasses tangled up in a blanket without realizing it. We did find them, but it is not easy once they leave the room in the linen bag to track down. Cell phones, please, you can bring those. Don't worry about this part. In fact, it makes communication even easier without the visitors being able to be present. So you can bring your cell phone. You can bring the charger for that. We can plug it in for you at night, however works best. And we do provide free Wi-Fi, so if you want to do something like a FaceTime, that can make that easier as well. As far as your day of surgery, directions will be given by your surgeon's office or pre-surgical screening if you are to follow this process I will mention right now. Only follow this if your surgeon wants you to do this, or they state so at pre-surgical screening. Now, the night before surgery, they're going to tell you to be drinking. After midnight, no solid food, but the changes for a lot of patients coming in now is that we want you to drink the morning of your surgery. For non-diabetics, this Ensure pre-surgery drink is what we would want you to drink. It is listed right here with this picture. They are providing it at your pre-surgical screening, or it can be available at many of our St. Alphonsus MedNow pharmacies. Again, you'll notice it does say pre-surgery. It's a very specific Ensure. That is a clear carbohydrate drink. This digests very fast. This means that you can drink it, and within 2 hours, your stomach will be empty and this will be digested. But in doing so, you'll also be hydrated by drinking this. So with this drink the night before, in the morning, repeat and use this Ensure drink. And we want you to have this completed by 2 hours before you arrive. The reason we want you to do this is so that you show up ready for that surgery in case, for instance, someone cancels in front of you and now you're up for surgery when you show up, or in case you accidentally show up late. Those are instances where This will make life easier for both the OR staff to make sure that we stay on schedule and for you, all right, to make sure that you are safe. If you follow these rules, again, with drinking and stopping this 2 hours before you arrive, you'll be safe for the surgery. The outcomes will be no different. There's no higher risk following these protocol than if you were to not drink after midnight. Okay, your stomach will be empty either way. You'll be just as safe. The reason why we are doing this, where we want you to drink, is that the carbohydrates do kind of give you a little bit more energy that day. By drinking, again, it'll be hydrating those kidneys. They're not going to be as stressed, which means that anesthesia will not even stress it out even more, right? We'll have kidneys that are hydrated and they can handle anesthesia easier. Also, with this, you're going to be an easier IV stick, and it does show through the research and what we're seeing at St. Alphonsus, it does reduce your risk for nausea. So we just see better outcomes and see patients tolerate surgery better. Again, no solid food after midnight. You'll perform your last surgical scrub that morning before you come in. No lotion again, but also no makeup that morning, and we do not want fingernail polish on your fingers due to the oxygen sensors that we put on your fingers. Fingernail polish can cause those to not read as well. Only bring necessary items to the hospital. That's a little reminder there. When you do arrive to the hospital and you come through the main entrance, you will be greeted by a screener. They're going to follow our COVID policies, and once you do get cleared from there, you will then go up to the pre-op area. You are allowed to have one visitor with you. Again, the one visitor for the day is allowed to come up with you to this area. You're going to review your medical and surgical history at this point, and also they're going to verify what medications you took that morning. This is, again, given to you by the nurse at the pre-surgical screening. So please follow what they tell you of what you can take that morning. It is very important. You will meet with the anesthesiologist in the pre-op area, and they're going to discuss the type of anesthesia you will be receiving. It is good to get information from your surgeon prior to this as far as what to expect of the type of anesthesia you'll be receiving, and they can give you a little bit more information on this as well. What I can tell you is that we do most of our surgeries with a spinal anesthesia. And with that, again, they have to give you more of the information on this, but just know this is the type of anesthesia that does cause numbness down your legs. With this, we do not have to give you general anesthesia during the surgery. This does not mean that you will not receive anesthesia to help you sleep during the surgery. This just means that type of anesthesia with general anesthesia where you have to have essentially ventilation for breathing, where there's a tube down your throat. We do not do that. You're breathing on your own. Again, they can give you more information on what this type of anesthesia is more like, but just know that we try to do an anesthesia that you can recover from easier, which is what our evidence shows with a spinal anesthetic, and this helps dramatically with our same-day discharge population as well, with being able to get up sooner, with less nausea, and just with a better recovery process for you. You will sign the consent for the anesthesia that you decide on with your anesthesiologist and go from there. The surgeon or one of his assistants, one of his PAs or nurse practitioners, will help sign your leg, your extremity, with the one that you're going to have surgery on. You'll be asked by this time, about 1,000,000 times it feels like, of what you're having surgery on. They will make it official after asking you by signing your leg, and you will be off to the OR. After prep, you will be wheeled over to the operating room. Know that you'll be in the operating room for about 2 hours. This includes surgical prep, where they will get you positioned onto the table and draped and cleaned. And what we used to do more often was insert a Foley catheter during this time. A Foley catheter is a line that they insert all the way up to your bladder that then empties any urine that you're making. Instead, what we do now for vast majority of our patients is we have you pee while you're in the prep area the morning of your surgery. That way you'll have an empty bladder during your surgery, and then after your surgery you will then be monitored based off our guidelines and orders to make sure that we keep your bladder within a certain range of how full we would want it to be. We'll make sure that we get you up to go to the bathroom and pee once you are safe to do so. We do have an ultrasound machine that we can then use to also keep track of how full your bladder is. And if needed, we can intervene based off our orders to then insert a catheter to empty that bladder if you are unable to pee afterwards. It is a very low percentage that this happens with patients. However, if needed, we have it available. All this is to give you the best outcome possible and to minimize the catheterizations. By doing so, we will minimize the risk of having any sort of urinary tract infection and helping you have the best outcome possible. Once your surgery is completed, we also transfer you to the bed that you will recover in. So that is the nice part about this, is that you won't have to worry about transferring to another bed out of the OR. You'll be placed straight into the bed that you recover in. Recovery room. This is about 1 to 2 hours that you'll be in the recovery room after your surgery. When you go here, a nurse will watch you very closely and monitor your vital signs. That means your blood pressure, temperature, and heart rate, respiratory rate, oxygen. We'll make sure all that is stable and remaining stable. Well, sure, anesthesia is wearing off. That means that if you've had general anesthesia, that you are waking up enough to come to the floor. Or if you've had a spinal type of anesthetic, that your legs are starting to wake up, that you can start to tense and feel those thighs. If you have any pain, they'll manage that afterwards, along with any nausea. If that does happen, we'll make sure that it is well managed during recovery. What will happen is the anesthesiologist will come by, and they will check on you and give the final sign-off before you come up to the floor. After PACU, where you have stabilized, you will then transfer to the room that you recover in before you go home. This is on page 8, where you can get more instructions on what to expect. We will start you on ice chips to make sure that you can handle some of the lighter foods prior. So this will include Jell-O and crackers. We call it a clear liquid diet. And once you do tolerate that, you can then go to a more regular diet based off what your surgeon has ordered. We will do frequent vital signs. This would be as per the doctor's orders. And if you stay the night, we will continue to do those as long as you are here through the night and the next day. We will monitor your swelling to the surgical extremity and just help you with knowing how to elevate and position, but we'll just make sure that everything surgically is looking okay on that leg. If you've had a spinal anesthetic, again, those cause numbness. We will monitor that numbness and make sure that before you get up, that you are safe to do so. And so this does mean that they will do assessments on your legs to make sure that you have sensation back and strength back prior to getting up and walking. Therapy will do this. Nursing staff will do this. The pain management program will start. Now I will go over more detail with this here in just a few minutes, but just know that we do implement your pain management immediately after surgery, and this does mean that we'll start your pain management that you'll be using at home in the hospital so that we can make sure it does work for you appropriately. You will get up and walk with physical therapy or nursing staff on your day of surgery. Again, especially those who plan on leaving the same day, you will get the same therapy anybody else would get before they leave. Continuing on, depending on your plan, whether you plan on leaving the same day or the day after, you will see these things happen as well. If you stay the night, for instance, and this is continued to page 9, by the way, in your booklet, don't be surprised if you do have labs drawn if you stay the night. And this is, again, part of the medical management that many of our patients receive here. Labs may be appropriate, and they will be drawn, if done so, early in the morning, as early as about 5:30, to make sure that those who round early, such as our nurse practitioner, hospitalists, and surgeons, can have these lab results to look at when they round. We will continue with that pain management program. We do have orders to stop IV fluids as directed by the doctor's orders, and they want to make sure that you can tolerate drinking water or other fluids and that you can keep them down without nausea. So we encourage you to be drinking water as soon as possible, and once you have met the doctor's orders, we'll get the IV fluids stopped. We will wean you off of oxygen as soon as we can. Now again, some patients have to stay overnight because they do have an oxygen need. So this means possibly the next morning we're working on this part again. But the goal is you will be off of oxygen before you go home. It is important to deep breathe and cough to help open those lungs up during this time as well. We will get you dressed in your own clothes up in the recliner prior to you going home. And so just know that we will mimic a lot of things that you'll be doing at home to make sure that you are comfortable with that before you go home. Now, as far as the pain management program, I'll go over that in some specifics here, but know that on page 10 it goes over the basics of pain control. Now, pain is subjective. It's 0 to 10 scale. You tell me what your score is, and we go off of that to then medicate you based off the appropriate medication. Please tell us if your pain regimen is working or if it's not. Communication with your nursing staff is key for this part, so keep us apprised on how your pain is doing and whether the pain medication you received is working. Have a realistic goal for your pain. Unfortunately, we will not be able to take all your pain away after this surgery. However, we will get you to a comfortable level of pain. So have that in your goal that you will have pain, but is it comfortable or not? When I say comfortable pain, this means that you can take a nap and it is not keeping you up. Also that you can do therapy and is not causing you to have to stop therapy. Yes, you do have pain, but you can still tolerate activity and be able to sleep. If it is uncomfortable, I want you to tell me, and that's when we go get your pain medication for you. So keep in mind, again, comfortable pain is the goal. The moment it starts to become uncomfortable, let your nurse know so we can medicate you. Now, we do try to use a multimodal pain management approach. This means that we are using different types of pain medication that have different effects. When we can get a more all-encompassing type of pain control by having these pain meds specifically hone on types of pain, you will notice a difference in your pain control. We also try to focus on pain medications that have the minimal type of side effects involved with them so that you have a safe recovery. I'll go over some of the basics here. Each surgeon might do things slightly different, and so again, I'll just go over the basics of these. Talk with your surgeon at your preoperative appointment about the plan for your pain control so that you can understand it before your surgery happens. Many of our surgeons are doing an intra-articular injection. This is with a hip or a knee. This injection has a variety of medications involved with them. That helps with numbing the area around that joint for a little while, and also it does have anti-inflammatory type medications mixed in with it. This will help for the first 24 to 48 hours especially, and you will feel it wear off many times. This does not mean that you'll jump from, say, a 2 for your pain to a 10. You many times go from comfortable to slightly uncomfortable. You maybe have to rest or take some pain meds for it until your body either gets used to it or the pain pills kick in. And so just give yourself some time and rest once it wears off. Relax and you'll be okay. Many of our same-day discharges go home without this injection wearing off, and they do not call back for any pain issues. It wears off and they do okay. Just anticipate that it will happen and be ready for it, and again, relax or take pain meds for it until your pain improves. Oral pain medication. There can be a variety of pain meds that you may see available to you. More and more, I am seeing Tylenol being scheduled for your pain control. A steady flow of Tylenol can actually help out more than you would think for a total joint replacement, so your surgeon may get this for you. Tramadol is a type of pain medication also called Ultram. It is classified as an opiate, but is on the lighter side of things, which means that the side effects are not as strong. But we are finding that for many total joint patients, this does work very well and gets you to that comfortable level of pain control. Oxycodone. This is a medication that is stronger. It is an opiate as well. It does have stronger side effects involved too. We use it only as we need to, and many times if you take Tramadol, it is at least there as a backup in case your pain is more severe due to getting up and moving. As far as meloxicam, that's a type of anti-inflammatory that I'm seeing, along with Toradol, another type of anti-inflammatory. Meloxicam, some patients are getting this in the hospital and going home with it. Celebrex is another one very similar to meloxicam as well. Toradol would only be used in the hospital if needed. Lyrica, I am seeing that one used as well for nerve pain. Just a few doses in the hospital can help out and actually last up to a month to help suppress that shooting nerve pain or burning nerve pain from an incision. So some surgeons are going to that. Baclofen is something that I am seeing used in the hospital and sometimes sent home with. That is a muscle relaxant type of medication. So this one can cause drowsiness. Be aware of that. Again, drowsiness can be affected by or from this medication, but when you can take it for those stiff, cramping muscles, it can help with that type of pain. Now again, based off what your physician's preference, you may see some of these. It can also be based off of what your medical history is, with what you can tolerate, with what your allergies may be. So know that there's a lot of variables in the pain medication part, but we'll do what's safest for you and what can help you the best. IV pain medication. Do not think that IV pain meds will be used on a regular basis during your stay. It is not a big part of your pain management. It is only there to make sure that if the pills are not giving you the pain management that you need, that it is a rescue medication to then get you back under control until we figure out what medication does work for you orally. So again, this is not going to be relied upon for your general pain control. To continue on with our pain management program, we'll talk about how to stay on top of your pain. It is good to understand that most pain medications are available every 3 to 4 hours. It is important, though, not to think of that as a schedule with your as-needed pain medications. Just know as soon as they are available, which is commonly 3 to 4 hours, but only take them if you need them. So again, if 3 to 4 hours has come by and you still feel comfortable, you do not need to take the pain medications at this time. Wait until you get to the point where you start to feel uncomfortable and take your pain medication that is available to you at that point. Let your nurse know and be on top of that. Take your pain medications with food. That is an important part of this. A little tip for when you're at home is you can have some saltine crackers or something like that at your bedside if you need to take some pain medication at night. But the important part is take something with the pain medication to have on your stomach so that it is not so harsh on you and causes any nausea. It is also very important that we talk about pain relief options that are not medication related. So there are other things you can do besides medications to help ease your pain and make you comfortable. Ice is something that is very important. A common routine that I see our surgeons say is 20 minutes on and 40 minutes off once you're home. So that'll be 20 minutes of ice on, take it off for 40 minutes, and do that repetition while you're awake. We do not use the ice machines here at St. Alphonsus. And what I mean by ice machines, some may be familiar with this already, but they are essentially this little device that has a cooler with ice water in it, a line that goes to a pad that wraps around, for instance, a total knee. And it pumps the water through this pad. None of the water touches your skin, but it keeps cold water going through it. These devices both are very expensive, and through our clinical practice guidelines and through research, it shows that they are not a huge benefit when looking at your recovery process. We get the same recovery by using a simple ice bag. If you have more questions on this, you can talk with your doctor about that, but just know that here at St. Alphonsus, this is something that we have moved away from and have found that we have good outcomes with patients just using our ice bags. And in fact, again, recommendations show that we do not need to use this for our total joint population. Any other sort of relaxation techniques, whether it be deep breathing or imagery, distraction, those can help with your pain as well. Repositioning that leg from time to time while you're relaxing can help out with pain tremendously. And of course, rest. Rest with your legs up, and this will help with pain as well. Page 11 goes into how to best prevent nausea. First of all, let us know if you have a history of nausea with any surgery, and we can make sure that you are getting the medication you need before surgery to prevent that. Start with ice chips. Advance your diet as tolerated, as I mentioned earlier. Always take pain meds with food, and that will help prevent nausea. And again, communicate with your nurse if you are experiencing any nausea. Medications are available if needed. So what this means is that, as an example, I've had patients who planned on leaving the same day of surgery. One of the holdups I've had is nausea. One patient in particular had some nausea the day of surgery. They didn't feel like it was anything to tell the nurse about. It wasn't severe, so they thought they could power through it. Then therapy happened. They got up and started moving and walking with therapy, and that nausea that they had all of a sudden became a lot more severe. We had to stop therapy, wheel the patient back to the room, and it took about 2 or 3 hours to get that patient's nausea under control. It can be really hard to catch up with nausea if you let it get too far ahead of you. So if you just get a little bit of nausea, let us know and we can nip it in the bud, take care of it, and you can have a successful therapy session and go on how you're supposed to with your recovery. Postoperative risks. I'm going to go over real quick the risks that are involved with these surgeries. Again, this is not to cause any anxiety. This is to go over how to make sure we have the best outcome, to understand the risks, and how to prevent them from happening. Page 12 goes over infection. Now, antibiotics are going to be given to you the morning of your surgery, and you may get a dose or two afterwards in the hospital. When you go home, you may be given antibiotics based off the surgeon's preference as well, depending on your risk factors. Take those as they're prescribed until they run out. Again, this does not mean that you have an infection going on if you are on any antibiotics. This is to prevent them. As far as the scrub that you will be using before your surgery, again, when you use this appropriately before the surgery happens, this does reduce your risk for infection. Good hand washing will be performed. We'll do that in the hospital, you do that at home. Anytime you need to touch that incision at home, clean hands every time. Keep the incision dry. Now some surgeons will want you to keep it dry during a shower. This means that you will put Saran Wrap Press and Seal around the dressing itself, take a nice quick shower, and then get back out, take the Saran Wrap Press and Seal off. It will not be too tacky for your skin where it causes any sores. That's what's nice about it, but it will keep you dry. If for some reason a little leak happened, that's okay. Either replace the bandage, or if you had the bandage off already, then pat dry the incision with something clean and allow it to air dry. If your surgeon allows you to get your incision wet during the shower, then again, take a very quick shower. Only briefly let water run over it with soap. Do not scrub it, and when you get out, do not rub it when you dry it, just pat dry. Make it very fast. Nobody will be taking any baths or going to any hot tubs where you soak anything. Again, there will be no water aerobics. You'll be surprised how many times I hear that one, but nothing where you soak the incision until your surgeon lets you know otherwise, and that is for every single patient. Discharge education will be given on signs and symptoms of infection. This sounds a little backwards, but we want you to recognize an infection fast, and we want you to let us know right away if that's the case. So this means if it's Friday and it's midnight and you look down at that hip or knee when you get up to go to the bathroom at night, and all of a sudden it's red and it's hot, that's a time to call, and you don't waste any time. You call the surgeon and let them know. If it's after hours, all surgeons have an answering service that will then guide you to what the next steps are. They contact the surgeon or whoever's on call, who then contacts you back. But just know that answering services are available after hours. The deal with this as well is recognizing it right away. The signs and symptoms are on page 12. Normal incisions will be pink. Normal incisions will be warm. But anything that is hot and very red, we do not like that. So, anything that is abnormal, follow what the list shows you. Call anytime if you're worried. You'll possibly need antibiotics prior to dental work, and this is even for cleanings. So there's certain periods of time, at least 2 weeks before your surgery, that we don't want any dental procedures done. And usually it's about 3 weeks. That's about the average I see that surgeons want you to wait for even cleanings after your surgery is done. Now these antibiotics, I'm not talking about a big long course of them. Many times what I have patients report to me is that it's amoxicillin, 4 tablets that you take an hour before you have your dental procedure done, even cleanings. And this will just make sure that for those patients who are higher risk for infection, that we have you covered. Your surgeon is the one to tell you what to do for this part. They will guide you through what to do, not the dentist, but your surgeon. Know that our infection rates are very good throughout our hospitals at St. Alphonsus. When you follow these procedures, you will see a difference in this outcome. As far as blood clots go, page 11 goes over the risks of those and what to look out for. What you can do to help prevent them is after your recovery, you'll notice exercises ahead of time ankle pumps is one of those exercises. Continue doing that after your surgery. So while you're laying there in your bed or in the recliner, pump those ankles, get the calves compressing, get the blood moving through, and that will help make sure that you decrease your risk for blood clots. Compression devices, whether that be something what we call SCDs, sequential compression devices. What those do is they pump up from a little compressor, and it either goes around your calf or your foot. It'll pump up, squeeze, push the blood through, and then it'll relax, and it just does that routinely while it's on. There may be compression socks that you use as well if ordered by the physician. Just use those items in the hospital as directed. Blood thinners. Now, blood thinners are going to be ordered for every patient afterwards, and it'll vary based off your medical history and if you currently take a blood thinner. It can vary from anything from aspirin to Xarelto, Eliquis, Plavix. I see all different types based off what you have going on and what's going to be safest for you. If you are currently on a blood thinner, know that they will many times try to get you on that blood thinner after your surgery with what will be safest for why you take it and also for the surgery. So dose may change for a slight period of time to keep the surgery safe, but know that you'll many times go back on that same blood thinner. Many patients anymore, I see them use aspirin as their go-to anticoagulant if there is no history of blood clot issues. Take that as prescribed when you go home. Now, when you are home, every 2 hours while you are awake, so please sleep through the night if you can, but while you're awake, get up every few hours and do something. I'm not saying exercise every time, but get up, go to the bathroom. Maybe the next time you don't have to go to the bathroom, but it's time to eat some lunch. So go to the kitchen and sit down somewhere and eat that lunch and then get back to relaxing. You can be up for about 15 minutes at a time, but then 2 hours of relaxation between that, okay? As far as constipation goes, we already talked about prepping yourself, and that will help make sure that you have a decreased risk for this. Also, afterwards, continue that regimen, especially if you are relying on opiate pain medication. Keep taking a stool softener or a fiber supplement. It may take 3 or 4 days before your first bowel movement. However, a good rule of thumb is if it's been a day or two since your surgery and you still have not had a bowel movement, and you've been taking these items I already mentioned, that's where you would maybe add in milk of magnesia or something like that. One of those heavier duty medications. If you need to do that and it's been a day or two, please take it. If it's been 3 or 4 days and you still do not feel a bowel movement coming, this is probably where you need to get an enema or a suppository involved now. And many patients can give that to themselves and do that safely. So if you need to do that, you can. If you have any questions about this, you can call the office and see what the next steps would be. But again, just remember, it can be 3 or 4 days before that first bowel movement. If you want to, you can increase your fiber in your diet. That's great. But if you want to increase your fiber, increase the water in your diet as well. And that will help make sure that the fiber actually works appropriately. Page 6 and 8 go over risk for falls. This is a risk that is easily preventable, and that is by being safe. So that means always call for help when you get up in the hospital. Even standing edge of bed, we need to be there with you. Don't ever get up by yourself or with family unless you are told otherwise. So again, no family is there right now. If that changes and family is present, then you can get up with them. But just know in the hospital, you need to get up with staff unless your therapist says otherwise. At home, use a nightlight, pick up, throw rugs, get all that tripping stuff out of the way. Nightlights, they're making them fancy now. You can get a nightlight that is actually motion censored. And the moment that you start moving and getting up out of bed, it's going to go off and you can see where everything is and safely get up. Please continue to use your walker until you are told otherwise. Many times the rule of thumb is you will use that walker until it is in your way. So until you get to the point where you say, I don't know why I'm using this, it's just slowing me down and I don't need it, then you can stop using it. Up until that point, use your walker and be safe. Many times, a lot of our patients are still using that walker to walk into their 2-week appointment. Pets, do not trip over your pets. So yes, remember the infection risk that can be involved with them, but also understand that they can pose a fall risk. So with your pet, know where they are at all times when you're walking around. Again, you'll go home on a blood thinner. These blood thinners, again, will be prescribed by your surgeon and take as directed by your surgeon. when you go home. This will reduce your risk for blood clots, but there are some side effects that are expected. You will be expected to bruise up and down that leg. Do not be surprised if it's all the way down to your toes and up to your butt as far as the bruising goes. So you will bruise, it's expected. You will bleed slightly more than normal, that is also expected. However, I'm just going to go over the risks that can be involved with any blood thinner, including aspirin. And always remember, any medication you take, there are side effects. But I'm going to go over the side effects that can be involved with those and how to prevent them from happening. If you do experience any of these items in red that I have listed here, then you contact your primary care physician or go to the ER. The first couple of them, vomiting blood. It looks like coffee grounds when you do this. It's just the way that blood is digested. It will have these brown or black specks in the vomit, or red or black colored stool. If you are taking iron, do not let this concern you. However, if you are not taking iron, and you have the red or black colored stool, this can be a sign of a bleeding that's happening. Now, I have seen this not very often at all, but the few times I have were patients who went home taking aspirin. Sometimes NSAIDs can be hard on your stomach. The best way to take an NSAID is with food on your stomach. Now, aspirin, if that is prescribed, many times it is twice daily. It is best to take it with breakfast and then best to take it with dinner if that is the case. This will help it be digested easier. If you still get an upset stomach taking it this way, then you call the office and let them know you're not tolerating that, because we do not want you to suffer through 30 days or so of taking an anticoagulant like that. If you have a stressed out stomach trying to digest this for 30 days straight, that's where a gastric ulcer can develop. So just be on top of it. Let us know if you have any issues and we can help you out. Unusual bleeding that does not stop after an hour or red or dark brown urine. There are some medications that patients can be sensitive to and work too well on them. We want to find a nice threshold. Where are you safe with the surgery, with anticoagulation, while still being effective at preventing blood clots? If it is working too well where you're just bleeding and you can't get it to stop, you let the surgeon's office know or your primary care physician, and then they can dose you to the appropriate dose from there. If you fall and hit your head, you are at a higher risk for something happening as far as an injury goes. And the main reason being is that anticoagulants will cause, if there's a bleeding happening, it'll cause you to bleed more, or at least bleed longer. So, this is why I mentioned already, we stress not falling. If you fall and hit your head, you're a higher risk for issues to happen with a blood thinner in your blood. So if this does happen, you call the office or just get checked out. But do not take this lightly. Be serious about it. We want to make sure that you stay safe. As far as miscellaneous information, driving. Do not expect to drive as a patient for 3 to 4 weeks after your surgery. First of all, that leg, whether it be left leg or right leg, it may be happening sooner or later. Can you use the pedals safely is the key part. So can you lift that leg and use the pedals easily and safely? That's your first check off. The next thing is, are you on any medication that can impair your driving? The example is opiate pain meds. Those will impair you. So please be safe with that. Once you can use the leg safely and you are off of anything that can impair your driving, that's when you can start driving. Your surgeon needs to be the one that helps make that decision with you. And if you need to get anything like a handicap placard for parking, the surgeon's office is the one who will help you with that. You will have a discharge planner, also known as a case manager, involved in your care. Their goal is to make sure that you have a safe discharge home. So that means if there are any gaps needed to be covered for a safe discharge, they step in. An example is if you need to have home health ordered for you. Now, of course, everybody is expected to have a coach help them at home, but if your coach needs extra help to make sure you have a safe discharge home, that's where the case manager comes, orders it for you, and gets it sent to your home. Also, if you need to have a rehab stay, that is also where they stay in. So if you need rehab before you go home to be safe, they will go through with what's covered by your insurance, give you a list to choose from, and then you choose from there, and they will set everything up for you. If you need equipment, sometimes you don't find out till after your surgery that there is certain equipment such as a toilet riser that you do need after the surgery, and they can help order that and either have it sent to your home, have it sent to the hospital, or have it set up to where you can pick it up on your way home. They can help with this process. Assisting with lab work if needed. Many times this is more with the Coumadin patient. If you go home on Coumadin after the surgery, you'll have to have multiple appointments a week to have your blood tested, and they can help set up the first appointment for you and from then on. If you need physical therapy after your surgery, your surgeon will let you know ahead of time. Some surgeons will not do physical therapy immediately after the surgery for at least 2 weeks. Some surgeons want you to start immediately. If you're having trouble starting the physical therapy appointments and need help with that, they can help step in and get that ordered for you. Again, this physical therapy would be in the outpatient setting. We have many locations with St. Alphonsus. You can use other therapy areas as well. Just make sure that your surgeon is okay with the facility that you choose first as well. It is also best that you review your insurance benefits prior to your surgery. Just because you have a benefit does not mean you will qualify for that service. This is mostly for our private insurance patients. For example, I already mentioned, if you need a rehab stay, this does not mean that just because it is a benefit that you have in your insurance that they will deem you qualify for it after your surgery. They will look through all of your notes during your stay and then deem whether you actually qualify for that benefit. So please understand that part. Also, it is good to understand that you will be admitted either as an outpatient or as an inpatient. What this means is outpatient can even stay overnight, but that usually is more of a healthy patient who expects to go home sooner than another patient who has more medical needs. The patient who does have more medical needs to be followed many times will be admitted as an inpatient. This can be determined either by the office or some insurance companies are the ones to determine this type of admission status. It is good to know what you're being admitted as, so talk with the surgeon's office to know. And also, once you find out whether you're inpatient or outpatient, it is a good idea to call your insurance and see what this means as far as expectations for payment. Outpatient many times is a service that you pay percentage based on. That means that you would pay a percentage of each service that you receive during your stay. As far as inpatient goes, many times this is a flat rate with less variable in your payment. So again, have an understanding of what you're going to be admitted as, and then talk with your insurance company on what this means. That is it for the presentation today. Thank you for watching. Again, we hope that you got a lot of information out of this on how to have a safe and good recovery, that you know the things that you can do based off of what evidence shows us for successful recovery. Know that we want to answer any questions. So if you want to, you can contact me. My name is Ryan McIndoe. My phone number is 208-367-7015. You are free to leave a message on that, and I can contact you after listening to the voicemail. Also, if you want to email me, my email is my first dot last name, so that would be Ryan, R-Y-A-N, dot McIndoe, M-C-I-N-D-O-O, at stalphonsus.org. That is SAINTALPHONSUS.org. Again, you can email me too, and I'll try to get back to you in a timely manner. Again, I appreciate you listening to this. Contact me if you have any questions, and we hope the best for you. You will do great, and I will hopefully see you after the surgery too.